So in this segment, we're going to be talking about the NHS is essentially breaking down. I know I've done these videos before talking about the NHS and how much it's struggling, but it's just getting way worse. And we're going to be talking about some of the things that are happening at the moment. So you can see here that the COVID cases in the UK are extremely high right now, only surpassed by really France back in November. But I can see us surpassing their numbers quite easily, seeing as the numbers are going straight up. It's not curving basically. And if you look here, right, it's around I think it's at the start of November, end of October, we went into the first lockdown, right? And you can see the numbers falling, and you can see the numbers rising dramatically here, and we are way higher now. We're about double the amount of cases we were before the national lockdown. And so why we haven't got into a national lockdown is beyond me. I really am so confused about the situation. The NHS is struggling. The government a bit iffy on if schools are going to be opening and things like that. And the schools opening, we're going to be talking about that tomorrow. This one specifically about the NHS. So here at Dr. Oxford, Rachel Clark, Dr. Clark. She's well worth a follow on Twitter if you want to learn about stuff going on within the NHS. So she says, the silence from Keir Starmer on closing schools is as deafening as from Boris Johnson. Are both of you unaware how overwhelmed the NHS is? Clearly not. Or unaware that secondary age children have the highest percentage positive cases? Clearly not. Where's your leadership? And I know people can argue that, well, kids are less affected, younger people are less affected by the virus, but the thing is, what you don't take into account is chains of transmission, because typically people this age, kids and teenagers, they live at home. So what you're going to do is you're going to be infecting parents. Potentially, if your grandparents live with you, you're going to be infecting them. You're going to be infecting elderly relatives if you live with them. And what happens is that chain of transmission carries on. So your parents may infect other people if they're at work, and so on and so forth. Maybe at the supermarket you're infecting other people, and that's typically how chains of transmissions work. We know with this virus that typically you infect 1.3 people. That's before this new strain or new version of COVID was out. So we know this new version is far more contagious than the 1.3 number that I cited a few months ago, towards the start of the first lockdown. And so the question is, where is your leadership? And Keir Starmer has been very quiet, and we can be talking about him in a few minutes. Boris Johnson equally very quiet. So here we go to another tweet from her, which says that critically ill patients in Kent are being transported by ambulance and helicopter as far as Bristol, Leeds, Southampton and Portsmouth. Oxygen is running out. ICU nurses have gone from 1 to 1 to 1 to 4. So instead of having one person monitor the intensive care patients, you're having 4 people being monitored by one person. So if it goes to chaos and you hear machines start beeping and simultaneously or just one after the other, you got to feel for these nurses, because they do not have the numbers they need right now. And she's asking, please take COVID seriously. And if you haven't started taking it seriously by now, then you're a lost cause, I'm afraid. And we go to the article she cites here. So Kent hospitals overwhelmed as ICU bed capacity hits 137%. And it took me a while to actually figure out what that meant. But basically what that means is you've hit 100%. I want those patients, that 37% of patients being shipped out. So for every 100 ICU beds they have in Kent and some of these other places, basically they've been maxed out. So for every 37 extra people, they've been shipped out. I know that doesn't make 100% sense, but hopefully you can understand what I'm saying. Basically what I'm saying is they're way overwhelmed to the point where people are having to travel to ICU units further away. So what happens when those other hospitals get hit with COVID patients that need to go into the ICU, and their hospitals are full from people in Kent? What happens then? And you have a massive domino effect of people being moved hospital to hospital, in other towns and other cities, because the hospital in their local area has been full. And it's an embarrassing state of affairs, to be honest. More critically ill patients are being transferred to hospitals across England, as NHS trusts in Kent reported bed occupancy levels in intensive care reaching 137% on New Year's Day. 11 hospitals across the Kent and Surrey regions are failing to meet nurse-to-patient staffing ratios in intensive care, raising concerns for patient safety. And what's going to happen is, if a nurse can't get to someone quick enough because they're attending to someone else, which isn't their fault, and that person dies, what about that? A death that could have been avoided potentially. All because we do not have the numbers that we need in this country. Thresholds to admit patients to intensive care are being revised, and clinicians in the region say some patients who should be in intensive care are being looked after on other wards because there's simply not enough space available. It is thought the region is aiming to transfer more than 20 patients to other hospitals across England in the coming days to try and relieve the pressure. And the thing is, as these numbers keep mounting and more people keep ending up in their local ICU units, and those numbers are being filled up by not just people in that local area but other local areas, other further afield areas, what happens then? You're causing a domino effect where people are constantly being moved. And how do these people even get home? If you're being moved from Kent to, if you're being moved to Bristol to Kent, how do you even get home? You know, some of these hospitals are very, very far. It's a shambolic state of affairs. It's thought the region is there we go. The news comes as Britain recorded another. So this ought to be accurate from recording. So this was from yesterday. This article. So you know the COVID numbers obviously are different. But the news comes as 53,285 cases reported in 24 hours, with another 613 deaths, slightly down from a new record high of 55,892 cases reported on New Year's Eve. Patients are going as far as Bristol and Leeds, more than 230 miles away. It emerged earlier this week that patients had already been sent to hospitals in Portsmouth and Southampton. Data from an NHS dashboard for the Kent and Medway region shows there are 114 patients in critical care, with 55 on ventilators and only 83 beds available. So what you can see here is that these hospitals aren't equipped to deal with this pandemic. They do not have the staffing numbers. They do not have the beds numbers. You know, we've talked previously about how the UK has some of the lowest ICU units per capita in Europe. We're one of the lowest, and you can see that impact that is having, that underinvestment in the NHS. You can see the impact it's having. Nursing ratios have been stretched to 1 to 4 patients, a previously unthinkable and unsafe ratio before the coronavirus pandemic. The normal level is usually 1 to 1 for intensive care patients. So the normal level 1 to 1, now we're looking at 1 to 4. One critical care clinician speaking on condition of anonymity, because they get in trouble for this. If they speak out to the media, they get in trouble for this. Told the Independent the region was overwhelmed and the situation was only getting worse. And look, if you are an NHS worker, you know, and you can speak on the condition of anonymity, please do so. Please do so, because we need to know what's going on. They said Kent is currently at 137% of its critical care bed occupancy, and 78% of all its patients in critical care have COVID. It has opened up all its surge beds, and I know having must be a typo. I know having to transfer patients out 20 in the next days. So you can see, I know that didn't make 100% sense, that paragraph. I think there's a typo in there. What you can see is they're transferring massive amounts of patients out of these hospitals. And so if you want to read this article, fully recommend it. I'll link it in the description. And we can see here that, you know, this vaccine will in the end help us out, but we are not producing enough of the vaccine. The UK has got just over 500,000 doses of the Oxford vaccine available from Monday, while India has already made 50 million and expects to double that soon. India, you know, a country that's a developing country, has way more vaccines than us. So you know about India being a bigger country and stuff, but the question remains, why have India got so much more vaccine, so much more of the vaccine than we do? It's embarrassing. So this vaccine will not be our saviour in this case. This vaccine will not save the NHS because it's being rolled out far too slowly and the quantities are not there. So it's an embarrassing state of affairs for the British government, being outdone by India of all countries. You know, Essex declares a major incident over virus cases. This is from the 30th of December. A major incident has declared in Essex amid fears the number of COVID-19 cases could overwhelm the county's health services. And so there's another place. We've had Kent, now Essex, right? And if we keep going, we know that the nurse shortage has been there for a long time. The staff shortage, the underfunding has been there for a long time. All this pandemic has done is exposed how badly the country has been run, because our NHS has been underfunded for a decade, and this is the kind of the worst, not the worst case scenario, because there could be far worse cases, but this is one of the worst things that could have happened to it, because the NHS has been overwhelmed. Doctors and nurses are having to do insane amounts of shifts, looking after so many people. You know, nurse ratio is 1 to 4, so one nurse has to look after 4 patients in intensive care. The point of this is to say that this situation has been ongoing for a long time, and that these Conservative governments have made this situation. They haven't fixed it. They've not come in to solve anything. This is by design to underfund the NHS because they want to privatise it. This is their goal. And so that's why they won't put the money in. And you got propagandists like Tom Harewood or Horwood, whatever his name is, saying that, the NHS has got more funding this year and the last year than it ever has done. You know, he doesn't take into account inflation. He doesn't take into account where that money's actually gone. You know, has it gone to, you know, Dido Harding and Track and Trace? Because it has. And with all that money, where are you supposed to get these nurses and doctors from? You can't train them instantly. They don't spawn in. And that's the point, is to say that this system has been there for a long time. The NHS has been on its knees for a long time, and you're going to get more cases like this of ICU bed occupancy hitting 130%, 7% in a lot more hospitals, where a lot more people are going to be shipped out, and a lot more people won't be able to be seen in time, and they will die when they could have potentially been saved had it not come to this. And, you know, look at the numbers here in this country. Look how bad it is. You know, you can say the new strain is the reason, one of the reasons why we have such high numbers, but it's not the it's not the absolute fact, because we know that strain came from South Africa. So surely South Africa should be looking at these sorts of numbers as well. But if we actually look at South Africa, let's have a look. South Africa, where this variant came from, is lower than the European Union average. So it doesn't, obviously we're not taking into account things like testing, how much are they testing and things like that. But when we look at our hospital numbers, we can see they're extremely high right now, and so we can see that the nurse shortage has been there by design. That the government hasn't invested. They cut the nurses' bursary, they brought it back, but they haven't invested properly in the NHS. They haven't given healthcare workers the wages they need to even make these jobs look like something envious. Nurses get paid, I think it's like 18k or 20k or something like that. Like that's, do you know what I mean, for the work they do and the amount of difficulty that they put in. The fact that these people save lives and we're paying this amount is shambolic. And we go to our last two pieces, really, where this pandemic has really highlighted the fact that we've lost so many EU healthcare workers, and I don't blame them for leaving, because you don't stay where you're not welcome. And look, we read here that this is from 2019, more than 10,000 EU nationals have left the NHS since the Brexit referendum, almost 5,000 nurses. These new figures will add fuel to the concerns about a wider staffing crisis. And this happened last year. This is pre-pandemic. And you know what? We sure could use those nurses now. We sure could use those doctors now and those healthcare workers, because we are in big trouble. But I don't blame them for leaving. I think, if they felt like they were in a position where they weren't welcome here, then, by all means, because, at the end of the day, this government has fueled racism and xenophobia. And so the fact is, these people did not feel welcome in this country. And so if they went, to, their native countries or, another country within the EU or further afield, I don't blame them at all, because they made the decision that was right for them. Here's our final piece. This is, absolute morons here. COVID is a horrible disease, but it's very, very rare for its impact children. We'll be talking about this more tomorrow. There are still far more danger from journeys in cars or swimming or trampolining than COVID. Swim pools are closed, you dummy. Please do not let anyone persuade you otherwise. And this, person here is an absolute joke. And we go here to an actual doctor. The issue is transmission, Kirsty. Children transmit to their teachers and others at school, and from there into their homes. Parents, siblings, and grandparents are the ones affected. The NHS is overwhelmed. This is worse than April. Keeping schools open will cost untold lives. And we'll be talking more about schools tomorrow. But what you can gather from this is something needs to give here, and if it doesn't, we're going to be looking at far higher numbers, some of the highest potentially in the world. And so that is terrifying, to be honest, because we know that chances are, if you have to go to an ICU unit in certain areas, you're not going to be seen. And so this culmination of the underfunding of the NHS, the xenophobia and racism in this country towards not just healthcare workers and NHS workers, but to general people, has helped to cause this further problem. I hope people finally realise the damage that's been done to the NHS over the last 10 years. I really hope they do, because if they don't, then you're stupid, you're dumb, you're boring, because you have decided not to learn about what the problems this country actually has, and instead you want to believe a man who can't even comb his hair properly and promise you £350 million extra to the NHS every week, who has not been able to do so. Not properly anyways. It's not sustainable, it won't be long term. But I don't know what more to say, to be honest, but I hope the best for these healthcare workers, because we desperately need them. And when this pandemic is over, I know this country will not praise them as they should deserve, but I hope we do, and I hope Keir Starmer actually starts talking now, because he's MIA at the moment. There are tweets from the shadow health secretary. He's tweeted a few things, talking about it, the COVID emergency and all this stuff. But Keir Starmer's MIA at the moment. So he's tweeted his friend. He's talked about schools. But he's not talking about hospitals at the moment. He's MIA. Keir Starmer's MIA. That's the leader of the opposition, in case you weren't aware. And this NHS problem will last a long time. I hope people finally realise how badly the NHS has been treated by Conservative government. The NHS is not safe with the Conservatives. I think that's even something John Major has mentioned, that the NHS is as safe with the Conservative Party as a mouse is with a snake. That's how safe the NHS is. But I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.